Welcome back, my good people, and in this video we are going to discuss about danger signs during pregnancy. And this video is very important for our pregnant mothers. As you are aware, we've been doing pregnancy series, and we gave you good drugs that have helped you, and now you are very pregnant. And we told you all about early signs of pregnancy, and if you have not watched that video of early signs of pregnancy, click the link that appear up here or even in the description below, so that you can be well conversant with drugs that may help you to get pregnant and even early signs of pregnancy. Now that you are pregnant and you've started your antenatal care clinic, and you've been given this book that appears up here. It's called Mother and Child Health Handbook, Afya ya Mama na Mtoto, and that is MOH 216 booklet. And this booklet is very vital, and I want to encourage you to be reading everything about mother and child. And all fathers, you are also encouraged to read this book, because it will really help us in maintaining this pregnancy, and it will really help us in even eliciting what is happening in relation to the topic of today, that is danger signs during pregnancy. Now, when you are pregnant, the early signs might be there, the way we have discussed early, but some might come that overwhelms you. And when you see something which is very strange in this particular pregnancy, then you should be able to report immediately to any healthcare provider to help you and to help your fetus, so that you do not develop any complications and even danger signs that we are going to discuss in this particular channel. So if you love this video, kindly click this notification bell, written subscribe, turn it on for more videos that we post. And our loyal returning subscribers, hi, thank you so much for clicking this video again, and for your support, your constant support since we started this channel, and your comments and sharing, or even liking this our video. We really appreciate so much. Now let's discuss danger signs, something which is abnormal. For example, when there is bleeding vaginal, when you are bleeding. When you are pregnant, we are not supposed to bleed. You only bleed every month according to your menses timetable, the way you normally have it every month. But now when you are pregnant, bleeding is not supposed to occur. When there is bleeding, then we suspect that there is something. And if you suspect that there is something, then we should be able to know what type of something is happening to you. Perhaps you can be having placenta abruptio, placenta previa, the way I discussed in our previous videos about placenta previa, when the placenta is low-lying, and when the placenta is detached, that is placenta abruptio. More about it is in the description below. Even you can watch that video that appear up here about placenta abruptio and placenta previa. So when you are bleeding, we should be able to take a step and elicit what is happening to you, because placenta abruptio and placenta previa can bring what we call bleeding in pregnancy, which is not very good. We call them APH, antepartum hemorrhage, which is not supposed to occur. I've discussed about implantation outside the uterus, that is ectopic pregnancy. Ectopic pregnancy into details, you can also watch it in the description below. Sometimes you might have ectopic pregnancy. There is an implantation outside the uterus, and this may result in bleeding, especially ruptured ectopic pregnancy, which is an obstetric emergency. This one you should be rushed to theater straight away so that you can be helped. It can lead to death. In fact, it's one of the causes and leading of maternal deaths in Kenya. Molar pregnancy or choriocarcinoma. These are tumors, cancers that normally occurs in pregnancy, and this one should be elicited by ultrasound, and you will be given further advice about this choriocarcinoma. So this one can also bring bleeding a pregnancy. We call it molar pregnancy. And going ahead, when you have trauma during intercourse, when you are pregnant, what we were taught in college is that when a woman is pregnant, it is not a thumb of rule that you should not practice sexual intercourse. When you are pregnant, you should be enjoying sex until now you will be uncomfortable. Even you can enjoy sex maybe some few minutes to you starting labor, or some few minutes to deliver. Anyhow, anywhere, the way you like it. But when there's a friction, it can cause some vaginal bleeding, which we can elicit and explain, maybe tell your spouse now to limit the level of and the frequency of sexual intercourse. I've discussed about vaginal candidiasis or urinary tract infections. If they are not well treated, they can result into vaginal bleeding. So bleeding in pregnancy is not something which is healthy. It's not something which is good. When you notice this, kindly report to us so that we can make the necessary steps. Now, a woman presenting with abdominal pain, general abdominal pain or even low abdominal pain, you should be able to report to us, because this is a danger sign that you should not be able to notice, because pain alone can be due to several factors which can even result into spontaneous abortions. What I've talked about, placenta brachio, placenta previa, and even ectopic pregnancies can result into this particular pain. And uterine fibroids, those normal growths that normally affect the uterus, can really affect you and bring a lot of pain during pregnancy. We should be able to do an ultrasound so that we can be able to help you. Choriocarcinomas can also do this. Even ovarian cyst, ovarian mass, or ovarian tumors can also be concurrent with the pregnancies. Other conditions like appendicitis, urinary tract infection, inflammation of gallbladder, that is cholecystitis, can also bring severe pain in pregnancy. Even intestinal obstruction, particularly small bowel obstruction, can result into pain during pregnancy. So when you notice this, you should be able to come. We should perhaps do some few tests like maybe do ultrasound, urinary tract urinalysis, to elicit whether there is UTI, and then we treat you according. So when you notice abdominal pain during pregnancy, it's a danger sign that you should be able to take note of it. I've discussed nausea and vomiting, and in this relation we talk about severe nausea and vomiting, what we call hyperemesis gravidarum. I did that video, very nice one. Watch it in this link that appear up here, or even this description below, to know more about what causes severe nausea and vomiting in pregnancy. The first trimester, that is the first 3 months, due to hormonal imbalance, your hormones are changing. You will have a lot of vomiting, a lot of nausea, a lot of cravings, a lot of dislike with some food. But now when you are severely vomiting, then it's a danger sign, because you can vomit until you get dehydrated, until you are not able to walk. You lose a lot of electrolytes. Even your knees you cannot even uplift lift your feet. You cannot even walk, and you develop blood vision and dizziness. This one should be you should be able to be admitted. Fluid should be able to be pumped into your system so that you be stable, because severe vomiting normally cause dehydration, and this may affect you and even affect your fetus. So we do not want anything that may affect your fetus. So we should be in that situation. We should be able to rule out other infections like malaria, urinary tract infection, typhoid, brucellosis, because those ones can also cause nausea and vomiting in hypertensive diseases in pregnancy. This one can also be a danger sign, because when you develop blood vision and dizziness, and when we take your blood pressure, it's high, then this is called preeclampsia, and even it can go and even proceed to a complication called eclampsia. So this is a danger sign. When you notice this, you should be able to come to the hospital so that we take your blood pressure, so that we can know whether you are developing this kind of hypertension in pregnancy, which in turn can even affect you and affect your child. By 20 weeks of gestation, you should be able to feel, most mothers should be able to feel fetal movements in your uterus. When there's a reduced movement or reduced fetal movement in your uterus other than before, you should be able to report to us, because there might be a fetal distress. Fetus might be in danger, and there are very many causes of this. We should be able to do either Doppler or even ultrasound to know the state of your baby. So if there's reduced movement other than before in your tummy, kindly report to us so that we'll be able to take a step. Excess tiredness or even overwhelming tiredness, when you feel your face is swollen or your puffy face, swollen hand, swollen body, might be a result of anemia. When you are getting tired, now your blood levels may have gone down, and now you are suffering from reduced hemoglobin level, that is now anemia. And this is a danger sign, because it will affect you, and it will even affect your fetus. And you know, every woman, when you are delivering, there might be bleeding, there might be tear. So if you have a low hemoglobin level, it's a danger sign. So that's why we encourage all women to be attending antenatal care, because the antenatal profile that we are going to do, one of the key profiles is your hemoglobin level, and we'll be giving you drugs that you will take during your pregnancy period that will boost your hemoglobin level. I hope you have you've watched the videos that I did about series of antenatal care. I really talked too much into details about antenatal profile, all those tests you do when you are pregnant. If you have not watched that video, it will be available in the description below, or even it can appear up here. So when you are tired, when you have difficulty in breathing, might be a sign of anemia. So take a step of faith to come to the facility so that we see what to do. When your tummy is growing, when your uterus is growing abnormally, you might be suffering from what we call polyhydramnios, excess amniotic fluids. And I did a very good video about polyhydramnios causes, signs and symptoms. What you will notice is that when you are 5 months pregnant, you feel that you are almost 9 months. Your tummy is growing rapidly. So we should be able to check this by ultrasound to know the levels. And when we do this, we should be able to give advice and the necessary drugs that will really help you. Parting short is that I would like every woman to attend antenatal care clinic. It is very important, because we will monitor you from the beginning of the time you report to us until you deliver, and we normally encourage you to deliver in an hospital that when there is a complication, you should be able to be taken care of. Otherwise, if you love this channel, kindly hit the notification bell, hit and subscribe, turn it on for more videos that I will post. And to my returning subscribers, thank you so much for clicking this video again. I really appreciate what you are doing. Let's meet in the next video. And if you feel that you are really looking for a child and you've not succeeded, then watch this particular video. It will help you. There are very good drugs that I've recommended there, that if you take when you are looking for a kid, eventually you will get one. Thank you so much. Let me see you in the next video.